Hey there, it's Shannon, and I am from the Anxiety and OCD Treatment Center of Central Pennsylvania, and I am a therapist with lots of experience treating this disorder. I'm assuming if you're here on this video, because I believe this is my second video in this series, you already kind of know who I am. So I'm not going to go through that whole bit. But what we're going to talk about today are 8 misconceptions that I hear of frequently about this disorder. Okay, and so number one is OCD is just a personality quirk. So OCD is simply not a personality trait or a preference for orderliness or attention to detail, because that's what I often think people are referring to when they make those types of statements. And or when people say things like I'm so OCD or everybody has a little OCD, right? I think they're talking about attention to detail, a preference for orderliness, um, which is not a diagnosis. There's actually specific criteria and significant distress or impairment associated with the obsessions and compulsions that come from this disorder. And if you're here watching this, I imagine you already know that. Um, but it's really an incredibly debilitating mental health disorder. So we want to make sure that we're not making statements like I'm so OCD, because these statements minimize the seriousness of this disorder and it trivializes the experiences of those who truly suffer. Number 2, OCD is just about cleanliness. So again, we're kind of in this realm of like cleanliness, orderliness. But this is really one of the most widespread misconceptions, and that's that OCD only revolves around excessive hand washing or cleanliness. And so in reality, OCD encompasses a wide range of obsessions and compulsions, often very unrelated to cleanliness. And so to continue on with this particular misconception, sometimes people will say OCD is just about being excessively neat. And with some individuals with OCD, they may have cleanliness or organization related obsessions and compulsions, but other individuals experience intrusive thoughts and engage in mental rituals, reassurance seeking behaviors, lots and lots of other stuff. So number 3, people with OCD just need to relax. Well, if you have OCD and you're here watching this, you know that it's really not that simple. And OCD is a really complex neurobiological condition that requires professional help. And so if people could just stop or relax, they would. Number 4, individuals with OCD are crazy or weird, right? Well, so I'm here to tell you that is not true at all, right? They're not crazy, they're not weird. It's not a phase, it's not attention seeking. Again, it's a real disorder with lots of diagnostic criteria. Number 5, OCD is a highly treatable condition, right? So usually the misconception is that OCD is untreatable, right? And so I believe OCD is a highly treatable condition. And most research at this time points to the use of exposure and response prevention and medication as being the best path for OCD treatment. OCD is caused by trauma or bad parenting. So this is number 6. And so what we know and believe about OCD is that it's the combination of genetic, neurological, and environmental factors. So it's not caused by trauma and it's not caused by bad parenting. Number 7, people with OCD never get better. So this kind of goes back to that one about OCD not being treatable. So as I mentioned when we were talking about that, people with OCD who engage in exposure and response prevention, for the most part, show lots of improvement. Number 8, people with OCD are germaphobes. They're all germaphobes, I guess is the misconception. So although this can be a theme called contamination in OCD, not all individuals with OCD suffer from contamination or fear of germs. And sometimes when people do even have contamination fears, it's really more about disgust and folks think it's about germs, but it's really just this whole concept of disgust. So thank you for listening to these 8 misconceptions that I gathered for this video. And what can you do to change all of this, right? Is there something you could do? And so I say take a risk and start sharing facts you know about OCD on social media. Talk about your diagnosis, attend events for OCD awareness, and just be an overall advocate. And so, understanding and dispelling these misconceptions is really crucial to promoting awareness and empathy for individuals living with OCD.